How to masturbate safely after 60. Avoid these 3 big mistakes. The journey through life brings with it countless transformations, and among these, the changes our bodies undergo after the age of 60 are particularly profound and often misunderstood, especially concerning intimate aspects of well-being. A common, yet seldom openly discussed question that resonates deeply with many older men is whether the ways they experience and express their sexuality, particularly through self-touch, remain appropriate, beneficial, or even safe as they navigate these later decades. This isn't an isolated concern. In fact, it consistently emerges as one of the most frequently asked questions Dr. Emma Blake encounters in her extensive work. The inquiry extends beyond a simple, "Is it still okay?" to a deeper yearning for understanding. How can I engage in self-pleasure in a manner that is not only safe and respectful of my aging body, but actively supports my overall health and vitality rather than diminishing it? Dr. Blake, with her vast experience assisting thousands of men, is dedicated to helping individuals maintain a robust connection to their physical selves, foster unwavering confidence in their sexuality, and age with an unshakable sense of strength and inherent dignity. The topic at hand today delves into an area of men's health that is rarely brought into the light of open conversation, yet it holds immense importance for physical and emotional welfare. The responsible and healthful practice of masturbation after the age of 60, along with a crucial examination of 3 significant mistakes that every man in this demographic should conscientiously avoid. This discourse transcends superficial notions of shame or performance anxiety. Its fundamental purpose is to empower men to actively safeguard their circulatory health, preserve the integrity of their prostate, optimize their hormonal balance, and nurture their emotional equilibrium. If you, like many, have ever found yourself grappling with uncertainty regarding what constitutes normal, safe, or truly healthy self-pleasure in your later years, be assured that you have arrived at a place where clarity and support await. Let us embark on this essential exploration by first understanding the foundational reasons why this subject merits such earnest attention. To begin, it is paramount to offer a significant reassurance, a truth that often gets lost amidst societal taboos and personal anxieties. Masturbation is not merely a normal human behavior. It is, unequivocally, a healthy one. This truth becomes even more salient and beneficial as men mature into their older years. It's a natural progression for many men, as the years accumulate, to begin questioning whether their bodies continue to require or benefit from this form of release. Some may grapple with lingering feelings of guilt, perhaps rooted in earlier conditioning or outdated societal norms. Others might experience a sense of confusion, uncertain about the evolving needs and capacities of their aging physiology. However, the unequivocal truth, supported by medical understanding and extensive experience, is this: regular, gentle, and mindful self-stimulation stands as one of the most natural and effective modalities for proactively supporting male health, specifically after the age of 60. Its benefits are multifaceted and deeply impactful. Firstly, it plays a vital role in maintaining robust blood flow to the penis, a critical factor for both erectile health and the overall vitality of penile tissues. Secondly, it demonstrably supports prostate health, with various theories suggesting that regular ejaculation may contribute to flushing out prostatic fluids, potentially reducing the accumulation of substances that could lead to inflammation or other issues. Thirdly, engaging in self-pleasure, when approached mindfully and without stress, is a potent tool for lowering stress hormones within the body, such as cortisol, which can have detrimental effects on overall systemic health when chronically elevated. Finally, the calming effect it can have on the nervous system often translates into tangible improvements in sleep quality, fostering a more restorative and peaceful night's rest. However, understanding these benefits requires acknowledging a crucial nuance. An older body simply does not respond in precisely the same manner it did at 25, and there is absolutely no shame or personal failing in this physiological reality. This isn't a sign of dysfunction. Rather, it is a perfectly normal, intricate expression of human biology. As the aging process naturally unfolds, several physiological changes occur that directly influence sexual response and sensation. The skin, for instance, becomes notably thinner and often more delicate, making it more susceptible to irritation from excessive friction or harsh pressure. Nerve endings throughout the body, including those concentrated in the genital area, may experience a natural decrease in sensitivity or take a longer duration to register and transmit sensations, leading to a perceived reduction in responsiveness. Furthermore, blood vessels, which are fundamental to arousal and erectile function, can become both more sensitive and less elastic over time, impacting their ability to dilate and constrict efficiently. These collective biological shifts mean that the approach to self-pleasure must by necessity evolve in harmony with the changing landscape of one's body. The emphasis shifts profoundly away from brute force or aggressive intensity and moves towards a cultivation of presence. It becomes an invitation to tune in deeply, to genuinely listen to the subtle cues and rhythms of your body, reframing it not as a mechanical apparatus that needs fixing or optimizing through sheer effort, but as a living, breathing entity deserving of profound care, respect, and gentle attention. When this paradigm shift occurs, when men embrace this more mindful and compassionate approach, something truly transformative begins to happen. They report feeling more deeply connected to their own bodies, experiencing a profound sense of relaxation that permeates their being, and deriving a richer, more profound sense of satisfaction from their self-intimacy. And perhaps most importantly, their bodies respond in kind, often expressing gratitude through enhanced well-being and a more responsive, pleasurable experience. Regrettably, many men do not fully grasp these evolving dynamics and inadvertently fall prey to a set of three remarkably common mistakes, often learned and ingrained over decades. Let us now delve into these pitfalls and understand how to navigate them. Mistake number 1, rushing. This particular error is pervasive among older men who often, perhaps unconsciously, treat masturbation as a hurried, clandestine, and largely thoughtless act, something to be gotten over with rather than savored. This rushed approach, however, has profound and counterproductive physiological consequences. When you rush, your autonomic nervous system remains stubbornly poised in a state of heightened alert, effectively stuck in its sympathetic fight or flight mode rather than transitioning into the parasympathetic rest and digest state, crucial for genuine arousal and relaxation. Consequently, your blood vessels constrict, inhibiting the very blood flow necessary for robust engorgement and sensation. Your heart rate escalates, not in a manner indicative of pleasurable excitement, but rather as a physiological manifestation of a stress response. It is not uncommon for men in this state to inadvertently hold their breath or allow their minds to become incessantly distracted by external thoughts or internal anxieties, further severing the connection to their bodies. Instead of facilitating a nourishing, healing flow of blood and energy to the genital area, the body persists in an unwelcome state of vigilance. This physiological tension actively thwarts the natural processes of arousal, significantly diminishes the depth and quality of satisfaction, and inadvertently trains the brain to associate intimate touch with tension and urgency, rather than with safety, ease, and genuine pleasure. The imperative fix for this common mistake is elegantly simple, yet profoundly powerful. Consciously, intentionally slow down. Even an additional 5 minutes dedicated to this experience can yield remarkable differences. Begin by actively disengaging from the external world. Take a few deliberate, deep breaths, allowing your nervous system to begin its descent into a state of calm. Power down your phone, silence notifications, and eliminate any other potential distractions from your immediate environment. Crucially, grant yourself explicit permission to arrive fully and completely in the present moment, releasing any self-imposed pressure for speed or performance. You are not obligated to incorporate elaborate rituals or light candles unless these elements genuinely enhance your personal experience. What truly matters above all else is that your body registers and internalizes a profound sense of safety and unhurriedness. When your body feels safe, a cascade of beneficial physiological responses is initiated. Your blood vessels gracefully dilate and open, welcoming a more generous flow of blood. Your nerve endings, no longer dulled by tension, begin to awaken and become more receptive, and your inherent sensitivity progressively returns. It is within this serene and unpressured space that true, profound satisfaction blossoms, derived not from the frantic pursuit of speed, but from the mindful cultivation of presence. Mistake number 2, using too much pressure. This error is astonishingly prevalent, particularly among men who are navigating their 50s, 60s, and beyond. As the natural aging process unfolds, many men observe a subtle yet perceptible decrease in tactile sensation within their genital region. In an understandable but ultimately counterproductive attempt to compensate for this diminished sensitivity, a common coping mechanism emerges. They resort to applying increasingly harder grips or adopting more aggressive, forceful movements during self-pleasure. However, this compensatory strategy over time engenders a detrimental cycle. The consistent application of excessive force generates undue friction, unhealthy compression, and sustained stress upon the remarkably delicate and intricate tissues of the penis. It's vital to remember that the penis is not anatomically engineered to withstand or thrive under aggressive force. Its internal structure is composed of a complex network of highly sensitive spongy blood vessels, extremely fragile nerve endings, and pliable connective tissue, all of which are designed to respond optimally to gentle, steady, and respectful touch. If a man persistently applies the same tight, unyielding grip repeatedly over years, his body, in an unfortunate adaptive response, begins to recalibrate its sensitivity. This can, in some cases, lead to the development of a phenomenon colloquially referred to as death grip syndrome. In this condition, the penis becomes desensitized to lighter, more varied forms of touch, effectively conditioning itself to respond only to a very specific, often intense type of pressure, typically that of the individual's own hand. This profound desensitization can create significant challenges and frustrations in the context of intimate relations with a partner, as the partner's touch may no longer be sufficient to elicit the desired response, leading to disconnection and disappointment. Beyond the relational impact, the physical consequences of excessive pressure are also considerable. It substantially elevates the risk of developing localized soreness, persistent irritation, or even microscopic tears in the delicate skin and underlying tissues of the penis. These micro-injuries can subsequently trigger inflammatory responses, leading to a further reduction in sensitivity, discomfort, and a long-term sense of frustration and dissatisfaction with one's sexual experiences. The discerning and ultimately more beneficial approach is one rooted in gentleness and mindfulness. Begin by consciously loosening your grip, cultivating a lighter, more exploratory touch. Integrate the use of a high-quality, natural, and unscented lubricant into your routine. Lubricants are not merely about reducing friction, they also provide a protective barrier for the delicate skin, facilitate smoother movements, and can enhance the overall comfort and pleasure of the experience. Shift your mental focus away from a predetermined outcome, such as orgasm, and instead concentrate intently on the process itself, how each sensation feels, the quality of the touch, the response of your body. Reframe this act of self-pleasure as a therapeutic endeavor, akin to a gentle, invigorating massage for your circulatory system and nerve endings, rather than a forceful act. Understand that patience is a crucial virtue in this process. With consistent, gentle application and a commitment to this evolved approach, your body will gradually begin to adjust and recalibrate. You will progressively notice an increase in sensation, a greater sense of ease in your movements, and ultimately, a more profound and nuanced experience of pleasure. This mindful evolution leads us directly to the third, often overlooked, and deeply impactful mistake. Mistake number 3, ignoring your emotions. This particular pitfall often catches men off guard because it appears to have little direct connection to the physical mechanics of self-touch, yet it has everything to do with the deeper, often unacknowledged, emotional landscape surrounding the act. Many men, throughout their lives, have quietly carried a burden of shame, sometimes for decades. This shame might stem from formative experiences, perhaps being told during their upbringing that masturbation was inherently wrong, sinful, or somehow dirty. Alternatively, it could arise from a more recent unsettling feeling brought on by the natural, albeit sometimes disconcerting, changes that occur within their bodies as they age, a sense of being less than or past their prime. The critical point is that emotional stress, unlike a fleeting thought, does not simply dissipate into thin air. Instead, it subtly yet powerfully infiltrates and settles into the physical fabric of the body, manifesting as chronic tension in the muscles, impacting the rhythm and depth of the breath, profoundly influencing the state of the nervous system, and even directly impeding the physiological capacity to feel and sustain arousal. Unresolved shame, gnawing self-doubt, or unaddressed anxiety creates a pervasive state of tension throughout the body, and this very tension acts as a powerful antagonist to pleasure, effectively shutting down the pathways to genuine enjoyment and relaxation. The profound and essential solution to this emotional entanglement begins with an unwavering commitment to self-compassion. It is vital to internalize and truly believe that you are not broken. You are not somehow behind schedule in the grand narrative of life. You are most certainly not past your prime or diminishing in value. Instead, you are gracefully entering, or have already entered, a new and distinct phase of life, a phase that unequivocally calls for a heightened degree of self-care, more intentional awareness, and a greater measure of kindness towards yourself. Therefore, if you currently experience a sense of disconnection from your body, your sexuality, or your emotional core, grant yourself explicit, unconditional permission to begin the process of reconnecting. Approach this reconnection slowly, gently, and entirely, without the pressure of expectations or demands. Understand that this journey of rediscovery is deeply personal and unfolds at its own pace. Should you find yourself struggling to navigate these complex emotional terrains alone, remember that you do not need to. Reach out for support. This might involve confiding in a trusted medical doctor who understands the nuances of men's health, consulting with a skilled therapist who can provide tools for emotional processing, or even sharing your experiences with a close, empathetic friend who genuinely understands and can offer non-judgmental companionship. The burden of figuring this out alone is an unnecessary one. Now, having addressed the common pitfalls, let us turn our attention to the practical framework for cultivating a truly healthy and beneficial self-pleasure routine in your later years. Here is what Dr. Blake wholeheartedly recommends as foundational practices. Firstly, keep it impeccably clean. This is not merely a suggestion. It is a fundamental aspect of health and hygiene. Prior to engaging in self-stimulation, always wash your hands thoroughly with soap and water to minimize the transfer of bacteria. If you use towels or cloths, ensure they are fresh and clean for each occasion. A clean environment and clean hands significantly reduce the risk of irritation or infection, protecting your delicate tissues. Secondly, choose a quiet, undisturbed space where you can genuinely relax and feel completely at ease. The environment plays a crucial role in fostering the mental and emotional calm necessary for a truly satisfying experience. This dedicated space allows you to shed external pressures and fully immerse yourself in the present moment, free from interruptions or anxieties about being discovered. Thirdly, consistently use a gentle, fragrance-free lubricant. This is an invaluable tool, especially as natural lubrication may decrease with age. A high-quality lubricant performs multiple vital functions. It significantly reduces friction, thereby protecting the delicate skin and preventing micro-tears or irritation. It enhances comfort, and by allowing for smoother, more fluid movements, it indirectly supports healthy blood flow by preventing tension and undue stress on the tissues. Opting for fragrance-free varieties is important to avoid potential irritation from chemicals or dyes. And most critically, listen intently to your body. This is perhaps the most paramount recommendation of all. Your body is an incredible source of information, constantly providing feedback. If, at any point during self-stimulation, you experience pain, tightness, unusual swelling, persistent irritation, or any sensation that simply feels off, do not, under any circumstances, ignore these signals. These are not minor inconveniences to be pushed through. They are potentially important indicators that something may be amiss. Such symptoms could be signs of localized inflammation, circulatory strain, or even an underlying prostate-related issue that requires medical attention. Should you observe any of these warning signs, or if anything feels consistently abnormal, the most responsible and proactive course of action is to promptly consult with a qualified medical doctor. Never hesitate to seek professional advice when your body communicates distress. However, when approached with genuine gentleness, mindfulness, and an attentive ear to your body's wisdom, self-stimulation can indeed become a profoundly powerful source of healing, self-discovery, and ongoing well-being. If you are just beginning to re-engage with these aspects of your sexuality, or perhaps rediscovering the contours and needs of your body in your 60s, 70s, or even beyond, please understand that this is perfectly acceptable and, in fact, incredibly common. Many men embark on this journey of rediscovery later in life, finding new ways to connect with and appreciate their physical selves. This process should not be viewed as a regression, as if you are somehow going backward or reverting to an earlier stage. On the contrary, it is a powerful and beautiful act of evolution. You are not simply repeating old patterns, you are actively learning what your mature body needs now in its current state, rather than rigidly adhering to what it used to need or how it used to respond decades ago. This capacity for adaptation, for relearning, and for embracing the present reality of your physical self is a truly magnificent aspect of human experience. Because the fundamental truth remains immutable, regardless of age, your body still matters. Your capacity for pleasure still holds immense significance. And your self-confidence, your sense of dignity and worth is an invaluable asset that is absolutely worth protecting, nurturing, and cherishing at every stage of life. Therefore, the next time you consciously decide to allocate that precious moment of attention to yourself, approaching it with intention and self-care, allow yourself the profound liberation of letting go. Release any lingering pressure, be it internal or external, to perform, to rush, or to conform to outdated ideals. Let go of any lingering guilt or shame that may have weighed on your spirit. Instead, choose simply to be present. Be fully, deeply, and mindfully present with your body, with your sensations, and with your emotions. You, in your entirety, deserve that moment of unadulterated presence, care, and self-respect. If the insights and guidance shared in this discussion have resonated with you and provided a measure of clarity or comfort, Dr. Blake would be deeply honored if you considered subscribing to her channel. Here, in this community, real issues concerning men's health are discussed openly, candidly, and without an ounce of shame, because your health, your optimal function, and your profound fulfillment continue to matter immensely, vibrantly, and unequivocally at every single age and stage of your life. Until our next conversation, please remember to stay strong, remain informed, and most importantly, take truly good care of yourself.